All right, let's read. Okay, so today I want to talk to you about the periapical disease. All right, this is how we learned it. I know the nomenclature has changed, but this is what I'm comfortable with. I still use this nomenclature. All right, so periapical disease. We have acute apical periodontitis, acute periradicular abscess or acute apical abscess. We have chronic apical periodontitis, chronic apical periodontitis. We have phoenix abscess, and we have periapical osteosclerosis. All right. So acute apical periodontitis, just to simplify, is when you percuss a tooth and it's tender to percussion. That's what this means. This is the periapical status of the tooth, not the pulpal status of the tooth. It could be related to the pulpal status of the tooth, but sometimes it's not. Sometimes a healthy pulp tissue, a tooth with a healthy pulp tissue can exhibit acute apical periodontitis. Why? Well, acute apical periodontitis is painful inflammation around the apex of the tooth. This condition can be the result of an extension of pulpal inflammation. So it could be the result of pulpal inflammation, extension of it into the periapical tissue. It could be mechanical or chemical trauma by endodontic instruments or materials, or occlusal trauma caused by hyperocclusion or bruxism. Because acute apical periodontitis may occur around vital and non-vital teeth, conducting a thermal pulp test is the only way to confirm the need for endodontic treatment. As always, the need for endodontic treatment must be determined by pulpal status alone. Just because a tooth is tender to percussion doesn't mean it'll need a root canal. That's what it means. In today's episode of Reading from Pathways of the Pulp, let's talk about acute periradicular abscess or acute apical abscess, AAA. All right, so what is it? An acute periradicular or acute apical abscess consists of a painful perilon exudate or abscess around the apex. This abscess is the result of the exacerbation of acute apical periodontitis from an infected necrotic pulp. Although this disease can be very serious, the periodontal ligament may appear within normal limits, or it may be only slightly thickened. This is because the rapid progress acute in the temporal sense of the infection has spread beyond the confines of the cortical plate before the mineralization can be detected radiographically. Thus, the periapical radiograph may only reveal a relatively normal or a slightly thickened laminodor. So, a patient, basically what it says is that a patient walks into your office, their face is all swollen up. You take some PAs, you don't see a periapical radiolucency associated with any other suspected teeth. But the patient's face is all swollen up. No periapical radiolucency, but the patient's face swollen up. That is acute periradicular abscess or acute apical abscess. The abscess has developed so fast that there hasn't been enough destruction of the periapical region of the tooth to give you that periapical radiolucency. The only way really to figure out which tooth is the problem here, which tooth is the source of the problem, is pulp vitality testing. Okay, so you pulp test the teeth in the area, the tooth that doesn't respond to Your vitality test is the necrotic tooth that is the source of this acute apical abscess or acute periradicular abscess. The signs and symptoms of acute periradicular abscess include rapid onset of slight to severe swelling, moderate to severe pain, pain from percussion and palpation, and the possibility of a slight increase in tooth mobility. Now, really, the only difference between acute periradicular abscess or acute apical abscess and a phoenix abscess is that with the phoenix abscess, you do have a periapical relucency on your PA. You do see a periapical relucency on your PA. In acute apical abscess, acute periradicular abscess, you don't. That's the only difference between these two. Phoenix abscess, you see a periapical relucency on your PA. Acute periradicular or acute apical abscess, you do not. In today's episode of Reading from the Holy Book of Endodontics, I would like to cover the periapical osteosclerosis. What is that? Periapical osteosclerosis is excessive bone mineralization around the apex of an asymptomatic vital tooth. This radiolucency may be caused by low-grade pulp irritation. Because this condition is asymptomatic and benign, it does not require endodontic therapy. And this is a picture of it. As you can see, this area right here. Now, you read this, right? I read this for you. Tell me what's going on. What's wrong with this paragraph?